Hi class, let's focus on some diseases of the oral cavity now. So we're going to focus on tooth and gum infections. These are difficult to pinpoint when the normal biofilm described in the oral environment becomes a pathogenic biofilm. It can occur. If left undisturbed, this biofilm, generally speaking, is going to start to become pathogenic. The anaerobic bacteria within the biofilm start to damage the periodontium. Also, we have found that as we introduce carbohydrates into the oral cavity, this can cause the breakdown of dentition or teeth due to the production of acid as those carbohydrates are being fermented within the anaerobic biofilm that's occurring in our mouth. So here we can see a diagram of a tooth. The part above the surface is referred to as the crown. The part below the surface is collectively referred to as the root. The enamel is the hard part above the surface. Dentin is the softer pulp of the tooth, or softer filling within the tooth. It is non-living. And then we have the living pulp in the center that contains blood vessels and nerves. And anchoring the root of the tooth, we have two root canals that help to anchor the roots of our tooth. If we look at dental caries, aka cavities or tooth decay, it's one of the most common diseases within human beings. It involves the dissolving of the tooth surface because of the secretions of bacteria. The symptoms are not very noticeable, but they can range from minor disruption in the outer enamel surface of the tooth, so there can be small indentations in the enamel. There can be complete destruction in the enamel, that's very noticeable, or there can be destruction in deeper layers. That's typically going to manifest itself as painful and will also be noticeable. We can also have some deeper lesions resulting, and this can occur when the soft tissue inside the mouth, inside of the tooth, becomes infected, and this soft tissue is the pulp. These infections can lead to a pain known as a toothache, and once the toothache has occurred, generally speaking, the only remedy is to drill out the pulp and replace it with a filling. So we can first, if we look at the development of the plaque in the biofilm, first we have the pellicule, that mucigenous glycoprotein that forms over the tooth. Man, just thinking about this makes me want to brush my teeth. And then that thin mucus layer will have bacteria building up into it. And then those bacteria form a biofilm that secrete acid through fermentation. That acid will dissolve the enamel and eat through it. The first degree carie is just a small indentation in the tooth. It's not particularly dangerous. Second degree caries are actually going to work their way down into the dentin. And then the third degree carie, the ones that actually have physical pain associated with them, have exposure of the pulp, the living part of the tooth. If we look at these dental caries, they can be caused by a variety of bacterium, one of which is Streptococcus mutans. Streptococcus mutans is associated with dental caries, or cavities. This bacterium is an oral alpha-hemolytic streptococcal species. It's typically going to work in a mixed biofilm with other streptococci and some lactobacilli as well. Very early on in childhood, this dental caries are typically going to be discovered by Scardovia wiggeaceae, which is a newly discovered bacterium species. In the absence of carbohydrates, bacteria do not cause tooth decay, particularly in the absence of our complex or simple carbs, so most carbohydrates that you would want to eat. Soluble fibers, generally speaking, don't cause much tooth decay. But if you just stay away from carbs in general, you won't give that carbon source needed for the fermentation that produces the acid. Those fermentative pathways require carbs to be entering them. Here we can see an electron micrograph of the mixed biofilm. We have some rods and we have some cocci all mixed together. Here is a tooth that is stained pink, and on the side of the tooth you can see the biofilm or the dental plaque that is formed. Oh, just looking at that makes me want to brush. There are pathogens and virulence factors associated with the dental caries are typically going to focus on Streptococcus mutans. In the presence of sucrose or table sugar, Streptococcus mutans and other streptococcal species are going to make sticky polymers of glucose called a fructan and a glycan. These fructans and glycans are going to act as adhesives that bind these bacteria to the enamel in our mouth and make the sticky bulk of the biofilm. If we don't remove the biofilm is going to start to trap food, and as the biofilm traps foods, it results in a serious lesion that kind of has a positive feedback loop. Once the lesion starts, the lesion can trap more food, which causes the lesion to get bigger, which traps even more food. It just keeps growing exponentially. These Streptococci bacterium and other bacteria produce acids as they ferment the carbs within these lesions. If the acid is immediately flushed and the plaque is diluted in the mouth, it has very little effect. However, if the plaque remains densely compacted within the mouth, acid starts to accumulate in direct contact with the enamel. This pH lowers to below a pH of 5, and the calcium phosphate within the hydroxyapatite of the enamel starts to be dissolved. This initial lesion can remain localized in the enamel and repaired with initial inert materials or fillings. If the deterioration, though, continues unchecked, at a certain point, though, once it reaches the dentin, tooth destruction is going to speed up exponentially, and the tooth will eventually be destroyed. So hopefully that initial indentation is caught when it's a stage 1 dental carie, and we can just have a filling put in. And the bacteria that can cause our dental caries are typically going to be transmitted to babies and children by close contacts. So mom or the close caregivers are going to typically take this bacteria from their mouth and transmit it to the baby's mouth. There's even evidence of oral transfer of bacteria between kids at daycare centers, which should be no surprise to anybody. If we ask dental professionals, they typically are going to diagnose these caries based on the condition of the tooth. The culture of the lesion is almost never performed because it's typically going to be irrelevant, because regardless of the specific bacterial species, there's always going to be the same treatments. The best way to prevent dental caries is through a dietary restriction of sucrose and other refined carbohydrates. Complex carbs can also lead to dental caries, but they are not as likely to lead. In addition to restricting the consumption of simple carbs, we should also focus on regular brushing and flossing to remove the plaques. One of my favorite labs that I do with my face-to-face students is I do a toothbrushing lab where I have the students plate their mouth before brushing, after flossing, and then after using mouthwash. So we can look at the concentrations of free-floating bacteria within their mouth. And usually those results are pretty revealing and a very strong motivator for my students to increase the amount of oral hygiene that they have. Very small amounts of fluoride being added to drinking water can also make the hydroxyapatite more resistant to the acid produced by the bacteria, so the enamel of the teeth becomes more acid resistant. However, this is a fine line. Too much fluoride is actually going to cause the teeth to have a weird mottled white appearance or a brownish appearance, but at the right levels they help our enamel resist dissolving and actually promote remineralization of our enamel. So we'll find that there's low concentrations of fluoride in drinking water and low concentrations of fluoride in both toothpaste and oral rinses or mouth washes. We can typically focus on treating the lesion that's caused by the dental carie by removing the affected part of the tooth. So if there's a small dental carie, we drill it out and then have it filled in with an inert material. If it's an advanced dental carie, we just remove the entire tooth. And then however much is removed is replaced with some artificial material or inert material. Sometimes this could be as much as getting a crown put in. So if we look at dental caries, the two most common bacteria that cause dental caries are Streptococcus mutans and Streptococcus sobrinus. The virulence factors for this include the bacteria adhering to the teeth and producing acid, and to prevent it we should brush our teeth and use a fluoride supplement. And globally, pretty much everyone has dental caries. And if we look at periodontal disease has almost universal transmittance across the globe by the time an individual reaches the age of 45. Most kinds of periodontal disease are going to be caused by bacteria colonizing the mouth and causing inflammation within our gum line or gingiva. Gingivitis is the first stage of periodontitis or periodontal disease. So this is the mild inflammation of the gum line. Signs of gingivitis include, well, swelling or inflammation of the gum lines. There'll be a loss of contour. There'll be some red regions, particularly at the edge of the gums. There'll be an increase in the amount of bleeding of the gum lines, and pockets and spaces start to develop between the tooth and the gum. And these pockets can then store food and accelerate the rate of periodontitis. If gingivitis has persisted for a long time, periodontitis will then occur. You can think of periodontitis as a very bad case, or a very severe case of gingivitis. The pockets between the gums and the tooth continue to increase, and that causes more food to be stored there and causes more fermentation and more acid production. This is going to cause the bone to start to be reabsorbed, such to the point that the tooth actually starts to get loosened within its socket, and if the condition continues to progress unchecked, the tooth will actually fall out. So first we start with a normal healthy tooth that has nice happy pink gums or gingiva, but then we can have gingivitis occur, and that calculus can build up, and there'll be mild inflammation of the tooth, and then really severe gingivitis will turn into periodontitis as the bone and the gums continue to erode away, and eventually the teeth will fall out. Periodontitis can be caused by biofilms, so there'll be communities of bacterium. And it's almost never caused by a single microorganism. These polymicrobial biofilms need to have the right combinations and the right ratios of bacteria to start the periodontal disease, or to start this gingivitis, to initiate it, I should say. There's a common predisposing factor, though, and that is when the plaque becomes mineralized. So, and if that plaque becomes mineralized, it's called a calculus. And this calculus can form above and below the gingival margin, so above and below the gum line, and will induce varying degrees of periodontal damage. If the calculus is present, it leads to a series of inflammatory events that allow bacteria to cause periodontitis, to cause this disease. So what can we do? We can remove the calculus, and we can remove the plaque. This is one of the reasons why regular visits to the dentist, where they take that small pick and scratch your teeth, is actually good for you. That's the dentist scratching off the calculi and scratching off the plaque that are present in your mouth. We can also perform surgery, and the surgery can reduce the depth of the periodontal pockets. We can also prescribe antibiotics. Systemic or in periodontal packings that can be utilized to help kill off these bacterium. So, if we look at periodontitis, the bacterium that cause periodontitis are multiples. There's multiple bacteria that do that. The best way to prevent periodontitis is to clean your mouth out. And if we look in the United States, smokers have an 11% rate of periodontitis. Non-smokers have a 2% rate of periodontitis. So in addition to increasing your chances of lung cancer, smoking also increases your chances of having your teeth fall out. Woohoo! If you have any questions for me about this section, please feel free to post them on the discussion board or shoot me an email. Happy studies!